Hello, everyone. I'm Neshae, and I will be playing the role of a therapist who is speaking to the nursing director of a behavioral hospital on the impact of forced displacement. The behavioral hospital has been moving towards being trauma informed, and they are currently seeking help on how to be trauma informed while providing culturally sensitive care. The supervisor, well, the director, sorry, is also seeking knowledge on treatment techniques that will be beneficial to the refugees. Because this is a hospital that services multiple populations, for my portion, I will be educating the director on how to provide treatment services for children, adolescents, and adults. The approach that I will be utilizing with the client is a more psychoeducational approach. So, hello, how are you today?
I'm good. How are you?
So I know you want to know a little bit about forced displacement. So I'm going to explain to you the impact of trauma so that hopefully you can understand and utilize this in your hospital. So forced displacement is when a person leaves their country due to conflict, violence, and human rights violations. The person, they don't leave their country on their own terms. They're basically forced to do it so they can gain some sort of safety and opportunity. With forced displacement, there's a pre-flight, there's a flight, and resettlement. So the pre-flight is what led the person to flee in the beginning. It could have been some sort of conflict, it could have been a war, or something that threatened their life or their well-being. And the flight is the actual migrating. Did they travel by bus? Did they travel by boat, by foot, or any of, or however they got to where they needed to go? And while migrating, there were things that they may have endured, such as violence, abuse, either physical abuse or sexual abuse, being separated from a loved one, or witnessing the death of someone, and torture. And then when they get to their destination, it's called resettlement. So resettlement is when the person settles. They settle into the place, but they're finding it hard to adjust and to adapt with the new territory. Um, they may be finding it hard to find a job, find housing, or build relationships because of the mistrust that they have for other individuals due to what they've been through during their migrating.
Mm.
And um, so all of these traumatic factors, they can lead to PTSD, depression, anxiety, and social isolation. So in your hospital, when you're thinking about doing treatment, um, it's important to utilize a trauma-focused cognitive behavioral therapy technique because it helps target that trauma and it also helps them with their mindset and their behavior. So there's two therapies that are included in trauma-focused CBC, and that is prolonged exposure and cognitive processing therapy. So the techniques that you use are going to vary depending on age. And because you're housing different populations, you might want to keep that in mind. So for children, you wouldn't use a prolonged exposure because that deals with the person constantly reliving and retelling their story to the point where they basically understand their trauma and it helps them with daily functioning. And doing that could be detrimental to a child. So that's more so for your adult and maybe your older adult population. For children, cognitive processing therapy would be beneficial because it focuses on changing the person's mindset and helping them with their behavior. So, for instance, they may have an unrealistic and an unhelpful um, thought that stem from their displacement. So they may have a negative view of themselves and they may have a negative view of others because of that. So what you would do is you would help the person identify their triggers and come up with different ways to cope with what they have been through and to go on with their daily functions. And keep in mind when you're providing culturally sensitive care to people who were displaced, they, in the beginning, they may not understand that they have gone through any trauma based on where they were from. It may not be called trauma. It may be something else. So, and they may not know the impact that their trauma has had on them. So they may not know how to express themselves or how to communicate properly in the beginning. So with knowing all of this and understanding all of this, you can help them to improve their daily functioning and improve their communication. Do you have any questions for me at this moment?
No, I'm good. I think you basically gave me like a very good explanation of what forced displacement and all is and what the trauma situations are. So I get it. Thank you. Okay. Hello. So I am taking turns right now, and I am going to be the one providing the education to my client so that she can get knowledge about forced displacement as she works with people who might be dealing with forced displacement in that agency. So forced displacement basically is when a person is forced to move from his or her country due to war or conflict or anything that the person's safety and well-being. So there are three phases when people are forcefully displaced. They go through three phases, and each phase has its own trauma. Some of them have common traumas, but each phase has things that the individual is going to have to deal with, and all those things that they deal with comes with certain trauma. So for the pre-flight phase, that is when the person decides to leave because something is not right. So say if there is a war and people are getting killed, you know, that at that point, maybe one might decide, no, I have to leave this country before I get killed. So that is the pre-phase time. So these people are the people who are forcibly displaced at this point. They deal with, you know, seeing people get tortured. They lose their properties. Some of them actually get imprisoned. There is sometimes there's some cases of malnutrition, some physical assault, and, you know, extreme fears, like living in fears. So at this time, a person who is going through this is experiencing a lot of trauma. So trauma is coming from the torture that they are looking at, that they are seeing, the loss of property, you know, losing everything that you've worked for. That is a lot of trauma that people go through when that happens to them. And, you know, physical assault, when people go through the pain of, you know, being physically assaulted, that is trauma. So during the flight, that's the second stage, the second phase. So when people are running from one country to another, during the period between whenever they're leaving and whenever they get to the new place, that is the middle phase. And during this phase, people go through hunger. Sometimes people are not prepared. So they leave, like, you know, all of a sudden, so they don't have enough food, they don't have enough water. And sometimes people get robbed, depending on which means they are using to travel. Some of the people lose their family members. So lots of family members, and betrayal, and separation from family members, because some of them will just leave without their family members. So that is also a separation, and that comes with a lot of trauma. So once they get to the place that they want to go to, that is the last phase, and that is the resettlement. So at this stage, people are dealing with how to fit into the new place. Like they sometimes have to learn new languages. They sometimes have to learn a new way of life. Like even the food they eat, it might be different. So it's a lot of things that they deal with whenever they get to that point, the adjustment issues and everything. So all these phases comes with a lot of mental health issues. So people get depressed once they get settled. They now begin to recollect everything that has happened to them, and then everything keeps coming back, and then they feel depressed, and that so it's a lot of mental health issues really that is involved with forced displacement. People go through anxiety. People go through um, um, issues with conforming to the new place, or like adjustment issues, and people definitely go through PTSD. I'm sorry. So it's a lot of mental health issues. So for you to be able to work with people that have been through this and are experiencing such traumas, I'm going to be focusing, since you'll be dealing with a lot of people, I would also assume that you'll be dealing with adults also, definitely. So I will be focusing on how to help adults in this situation, how to help them better deal with their traumas. So I would say that for adults, they might be going through, I will be focusing on the from ages 19 to 40, which according to the psychosexual theory, they might be, they will, the developmental stage for them will be the intimacy versus isolation stage. So when somebody at this age, with this developmental need is going through such trauma, it's definitely a lot on them, because of course they are losing their loved ones. They are losing their identity. They are losing what they think is for them, like what their sense of belongingness. So basically, at this age, when people are dealing with intimacy versus isolation, and such things happen to them, they are definitely going to feel isolated, definitely. So when you're working with them, you want to work with them and focus on how to build their relationships back, and how to help them, meet them where they are, and help them develop from wherever they are, basically. So I will be, for that purpose, I will be focusing on the cognitive restriction technique, which is a type of CBT the CBT therapy intervention. So cognitive restriction is basically a CBT technique that is used to identify and replace irrational or like negative thoughts that triggers stress, anxiety, and depression. So with this technique, you will be focusing with helping this person replace all the negative thoughts and the irrational thoughts that a person is experiencing, all those thoughts that are able to trigger the stress, the depression, the loneliness, the feeling of loneliness at this stage of their life. You try to help them replace those thoughts with very positive ones. So when you're working with such a person at this age or at this developmental stage, what you are focusing on is to help rebuild this person's surroundings, whatever, say, for instance, a person who just came here by himself or by herself at this age. So this person do not have the family members. This person probably might not have a husband, a wife, a child, or anything. So the person is definitely lonely. So you will be, when you're using the cognitive restructuring, what you're doing is that you are helping this person for all these thoughts that are going to make her feel depressed and lonely. You are going to help her find a way to go about it, to replace those thoughts with more positives. Maybe, the fact that you are still alive is a way to, you bring the person's thoughts to that. Yeah, I know that you're going through this lonely situation, especially at this age of your life. But, maybe be thankful that you are still alive. Like, just certain things that are more positive to replace those negative thoughts that will be putting this person back into isolation, into loneliness, or into depression, or into anxiety. You just try to reframe this person's thoughts. So this is what cognitive restructuring is all about. So I would say that, you just have to basically focus on bringing a positive out of the negative situation of the person. So that is what this cognitive restructuring is about. Is there any other question? Is there any question that you want to ask me?
No, thank you
You're
so
welcome.
much for your detailed explanation.
Okay.